TV available.
The hands-free way to get news and weather you count on your schedule. Search WRCB in the Alexa app.
Crime Stoppers with Greg Glover, Wednesdays on Channel 3.
When they come out with the best of the best next year, I would put you on the list for Best Chattanoogan. Thank you for giving me this kind of your time this morning. I really appreciate it. Let's talk about your kids and masks. I had a conversation this morning with my daughter, high school daughter. You have one too.
Yes.
And she said, Mom, do you realize that I have not yet had a normal high school year? COVID was a part of her freshman year, her sophomore year, and now her junior year. Does your heart break for these teenagers especially?
I think it's difficult. It's been difficult for all of us, obviously, both for the kids, for the parents, for everybody. This pandemic has really impacted everybody. And certainly kids have unfortunately taken a brunt because, they don't have their usual school activities. Many of the seniors last year didn't have a graduation. Mm-hmm. And I think that as difficult as that is, and as hard it may be for some of them to really cope with not having that normal high school experience, I think they've had a different experience that probably has taught them something else, right? It's taught them that life is not always perfect. You're not always going to be able to go to that party Friday night, or your prom may be postponed, but it's for the good of our community that all of us are making changes. So I get it. My daughter, she worked during the summer, and I really encouraged her to wear a mask. She was working as a hostess, and it was difficult, right? Because if she wears a mask, all the other kids are going to be looking at her, well, she's different, right? Mm-hmm. And so they have to cope with that even without a pandemic. But I think as a parent and as a child, we have to have the discussion with our kids and really tell them that this, life sometimes is difficult.
Okay, to that point about looking at you like you're different because you choose to wear a mask or you choose not to. In some places now, parents have the opt-out ability. For little children, some parents have talked about social adaptiveness and how difficult it is for especially preschool-age children to not be fearful when the world they see is in a mask. I know we're trying to be protective of COVID, but the flip side of the coin is, are we hurting their mental health? Are we hurting other parts of them? Do you hear that question posed?
So that's one of those valid concerns, right? Is how are our kids going to be affected long terms in terms of their mental health? And they've probably sustained some insult to that. But I think kids are resilient. I think that once we get to the other end of this pandemic, surely there will be kids that will have suffered and perhaps have depression and many other issues that will need to be addressed. There's no doubt about that. But I'm thankful and I am hopeful that our kids are resilient, and they will see what we do, right? So as a parent, we need to show them what the right thing is. We need to make them understand that wearing this mask is important for you, but it's also important for all your other friends, right? Some of your friends haven't had an opportunity to get vaccinated. Mm-hmm. And some of your friends, you could argue, can't get a mask, right, for whatever reason. So you have to let them understand that they're not alone in this.
Would you recommend the vaccine for anyone between 12 and 17?
I do recommend the vaccine to anybody 12 and older for sure. And when it becomes available and approved for the younger group, I would also strongly encourage parents to have that discussion with the pediatrician and really think about what is the best thing for their child. We know that the vaccine is effective in keeping you out of the hospital and keeping you out of the ICU. So for me, it was an easy choice. Mm-hmm. But I know for others it's not easy, and that's why we're going to continue to give the information that parents need to make their choice.
Here I'll sound like I'm pushing back at you, but I'm not trying to. A couple of local schools have gone virtual. If you do the math, I think that the percentage of the COVID infections at each school, the two that I'm thinking of, ends up working out to about 3% of the population, student body population. They've gone virtual for 10 days, and then I guess they'll come back and see. Some parents will say, gosh, the flu has impacted our school more drastically than these numbers, and we didn't shut down for that.
So I think it's not an equal discussion to compare COVID to the flu. And I understand how, depending on the narrative that somebody wants to discuss, yes, the flu is a viral respiratory infection similar to COVID. That part is true. And yes, the flu transmits a lot of ways like COVID, like SARS-CoV-2 does. But the outcomes are very different. If you look at the deaths from COVID-19 this year and last year, and you compare them to yearly deaths of the flu, it's significant. The deaths from COVID-19 are significantly more. There's no doubt about that.
Among young people as well?
As a population, right? And we know that there are kids that die of the flu every year, right? Kids die of the flu every year. So that's why I think it's not a fair comparison to make.
Okay.
And I understand how, if you really want your kids in school and you really think that we shouldn't close the schools, we really have to look at the bigger picture, right? Sometimes small percentages look really small, but when you apply that percentage to a population, those are a lot of people, right? Those are a lot of kids, right? And imagine if it was your kid, right? If it was that one kid who ended up in the ICU, or that one kid who died, right? The statistics are, at that point, not going to mean anything to you, right? So I think we have to think as a community for the good of societies. We really have to protect everybody.
So if we went back to masks, right, if that's what the kids did to give them as much normalcy as possible, would it be fair to think that if you combine mask wearing in school and maybe we get that threshold of vaccinated up above 50, hovering between even 55 and 60%, if we get there, and we get there just theoretically, say by New Year's, is it reasonable to think then that moving into 2022, this will go away? Or are we looking, I know you don't have a crystal ball, but are we looking, do you think, even still 2 or 3 years of this?
So I don't think we have 2 or 3 years of what we have today, for sure. I think, and if you look at how Delta has affected other parts of the world, it does eventually start to go down, right? So I am hopeful that there will be a turnaround with the current surge and the Delta. Hopefully, as more people make a decision to vaccinate, if we can get everybody to hold on to that mask a little longer, we can turn the wave and make this Delta surge start to go away. I think, like we mentioned before, I think COVID is not going to go away. Even if we vaccinated everybody, if magically everybody gets a vaccine, the virus is probably going to hang around as what we call an endemic, right? Not a pandemic, just like all the other cold viruses out there, right? We get colds every winter. These are viruses that are going to hang around for a while. So I don't think 2 or 3 years from now we will be dealing with a pandemic, and I surely hope we're not having a discussion 2 or 3 years from now still, should we have masks or not in school. I think there is a light at the end of the tunnel, but in order to get to the other side, we really need to work together and as a community, wear our masks, get vaccinated, and do the right thing for our kids. That's what's going to get us to the other end.
I think I'm going to leave it there. I had more questions, but I think I'm going to let you have the final word.
And I thank you for the invitation. I just, again, as a parent of 2, I really want them to be in school. I want them to have a good time. I want them to enjoy high school, elementary school. But for all the parents out there who want what's right for their children, we really need to protect them from this virus. Let's do the right thing, mask up, get your shot, and let's get to the other end.
Nice to talk to you this morning.
Thank you.
Imagine a salad made with fresh-cut vegetables and warm hand-breaded chicken. Does that even exist? Not yet, because we don't make it until you